It's been a tragic time
that has shown a bright light
on our halting national response to a global crisis,
and on deep health disparities we've failed to address for decades.
But if this light has illuminated challenges we must face, it has also shown us strengths we can build upon.
From research that created vaccines to save millions, to the power of community action to narrow gaps in health outcomes.
Now that Americans can see clearly that public health success or failure is a matter of life or death,
can we leverage our time in the spotlight to empower our mission?
Public health, visible.
Welcome to the 2021 Bloomberg American Health Summit.
In this moment of visibility, we'll consider 4 key issues this morning.
As our nation recovers from the worst of the pandemic, it's clear that many communities were hit harder and will take longer to recover. We'll explore the warping effects of structural racism and the social and economic inequities that lead to poorer health outcomes for far too many Americans. We'll also learn from successful efforts to think about an agenda for the future.
The past 2 years have not only brought us a global pandemic, we've seen rising overdose deaths and homicide rates with shocking declines and disparities in life expectancy. At this unprecedented moment, misinformation and threats have undermined public health like never before. We will be hearing from public health officials about working through this tumultuous time and what's next.
The COVID-19 pandemic will cast a long shadow, but it won't be the last epidemic we face. Looking toward the future, what can policymakers and public health officials do now to tackle urgent challenges and prepare for future public health emergencies at the same time?
We all recognize the Johns Hopkins map, which symbolized the most extensive use of public health data in our nation's history. How can we learn the data lessons of the pandemic to address other critical health challenges: addiction and overdose, adolescent health, the environment, obesity in the food system, and violence?
We know that public health has a rare moment of heightened visibility on the national stage.
And the Bloomberg American Health Initiative is seizing this moment by pushing forward on all our key efforts. Since its inception, the initiative has graduated 43 Bloomberg Fellows
and named 211 fellows from 40 states, Washington, D.C., and 1 territory.
And collaborated with several hundred organizations.
Funded more than 200 projects and named 20 Bloomberg professors and Centennial Professors of American Health.
It's all of us together who keep public health visible.